I'm going to use this time in the voiceover to talk very specifically about HIV in children and how it may be different. So first of all, as a quick review, AIDS is caused by HIV, and HIV really overwhelmingly destroys the body's ability to fight infection. So infections that would normally not really affect us as healthy people can destroy the immunity of children who are affected with HIV. AIDS is considered the advanced stage of HIV. In most cases in children, in terms of HIV and AIDS, is through perinatal transmission. You'll learn a little bit more specifics about that in a few slides. However, you will also likely learn more about that in your OB rotation. For newly acquired HIV infection in teens, unprotected sexual intercourse is the primary mode of transmission, and IV substance abuse still is one of the causes of HIV and AIDS infection. So in terms of this vertical transmission, which is what we refer to as the process by which children acquire HIV/AIDS, moms who are infected can transfer the virus transplacentally or through the delivery process, where there may be an exchange of blood in some way. We are getting less and less incidences of vertical transmission due to the treatments that have really come into play here in the last several years with antivirals. Additionally, when we are concerned, we will do C-sections with moms and will advise them not to breastfeed, as transmission can occur through breast milk as well. So during birth, they can get it from blood, the amniotic fluid, and genital tract exposure, and after birth through breast milk. So as you may recall from the adult discussions regarding HIV and AIDS, this virus affects multiple systems and eventually will destroy the child's immune system as a whole. If the child is left untreated, they are left unprotected from a myriad of fungal, bacterial, viral infections, which can ultimately lead to the death of the child. So with regards to how this may present itself in children, infants are asymptomatic at birth. So we have no indication, but over time, HIV signs and symptoms that may show are somewhat nonspecific. So you may see some lymph node enlargement, liver and spleen enlargement. You may get thrush or oral candidiasis, failure to thrive. You may start to see the child have bouts of chronic diarrhea and delayed development as a result of failure to thrive and fluid and acid-base imbalance. The kids will then start to develop recurrent bacterial infections, and that then begins the investigation into what may be causing the condition in the children. So while it starts out nonspecific, as we begin to, by process of elimination and running blood tests, especially if we know the child is an at risk candidate for HIV and AIDS infection. The CDC guidelines do recommend that any child that we suspect as being a potential exposure to HIV be screened and detected as soon as possible to prevent those long-term complications that can result. So in terms of what we do for children specifically with HIV, our first important things are to help prevent infection. This is a little more difficult in children because children are in general much more difficult in terms of protecting from infection. They are not good about hand washing. They are often in settings where they may be exposed to more germs, childcare settings, school settings, activities that they may be doing. So it's up to us as caregivers to ensure that the child is in a clean environment, frequent hand washing is used, that parents are taught about limited exposure to people with infections, and ensuring that we follow guidelines for administering vaccines to these children. In terms of the adolescents, we definitely need to discuss safe sex practices. The other factor that is really important in terms of managing children and their families when they have been infected with HIV is adherence to medication regimes. The treatment protocols with antivirals can be really complex for families and children and can be very time consuming. So it is important that we recognize that and understand that this can make it very difficult for families to follow. Adherence, however, to those protocols is essential in order to keep the child in a healthy state. Some of the common complaints for why adherence is difficult, these kids require very frequent dosing. They are on daily schedules. Children often do not like the taste and the side effects that may go along with them, and there are specific dietary restrictions that may be associated with them. So under these circumstances, we really need to work and be creative in terms of coming up with what will work best to have this family have success in getting the child to take the medications and also success in adhering to the protocols. We do need to promote respiratory function in these children. I put a picture of a little girl blowing bubbles there as a reminder. Remember, getting children to do deep breathing and coughing and clearing those airways is not easy to do, and we have to get really creative about how we do that. And we've talked in class about how to do that. But it is very, very important that we maintain respiratory function because these children are so prone to frequent pneumonias. Additionally, we have to promote good nutritional intake. Often these children, as I mentioned, are failure to thrive, and therefore we need to make sure we get nutritionists on board who are working with these kids. Oftentimes they may need long-term total parenteral nutrition. They may have NG tubes or G tubes on the long term to provide good dietary intake. It is not unusual for these kids to get diarrhea, often due to infections and gastroenteritis. We really do need to monitor the hydration status of these kids pretty consistently and understand that thrush or oral candida infections are very common. And we did talk about thrush, so everybody is familiar with what that looks like. Additionally, it is vitally important that we provide a lot of support to these families, as this is not an easy diagnosis and they need supported not only in managing it, but in also interfacing with the community and meeting the safety needs of their children. And finally, when we're working with children with HIV and AIDS, we need to remember that we are always promoting growth and development. That is of utmost importance. And so it's very important to pay attention to the developmental level of the children that we're working with and adapting what we do and how we teach to that particular child's level. So for toddlers and preschoolers, they really don't understand the concepts of immunodeficiency, but they do have to undergo treatment, and so we need to approach them with that developmental level in mind. They're not going to understand, and we may need to come up with lots of games and creativity to get these kids to comply. With school age and adolescents, they need to be informed of their diagnosis. They are at an age where they can begin to take responsibility, and we do need to begin counseling regarding sexual transmission and safe sexual practices.